Hello, my name is Yvonne Calzada. I am taking IDS 403, Preparing for the Future. Today I am presenting my very first video blog, Relationship Between Technology and Society. The technology that I have selected to research and present in my video blog is surgical approaches that utilize robotic surgery. Presently, robotic-assisted surgical techniques are not yet well established among surgeon practice groups beyond a few surgical subspecialties. I would like to begin by giving you a brief history of how robotic-assisted surgical techniques began. According to the official Medical Robotics News Center, in 1985, a robot, the Puma 560, was used to place a needle in a brain for a biopsy using CT guidance. 3 years later, the same machine was used to perform a transurethral resection. In 1987, robotics was used in the first laparoscopic surgery, a cholecystectomy. In 1988, the Probot, developed at Imperial College in London, was used to perform prostatic surgery. The RoboDoc from Integrated Surgical Systems was introduced in 1992 to mill out precise fittings in the femur for total hip replacements. Further development of robotic systems was carried out by computer motion with the AESOP and Zeus robotic surgical systems, and Intuitive Surgical with the introduction of the Da Vinci surgical system. The lack of crossover between industrial robotics and medicine, particularly surgery, is at an end. Surgical robots have entered the field in force. Robotic telesurgical machines have already been used to perform transcontinental cholecystectomies, which is a voice-activated robotic arm routinely maneuvered endoscopic camera, and complex master-slave robotic system, which is presently FDA approved, marketed, and used for a variety of procedures. It remains to be seen, however, if history will look on the development of robotic surgery as a profound paradigm shift or as a bump in the road on the way to something even more important. Surgeons working with biomedical engineers and others with knowledge and skills relevant to this endeavor are exploring the role and value of robotic surgery in patient care. This is potentially a game changer, a paradigm shift. Naturally, there is tremendous interest not only in the clinicians who deliver patient care, but of course in the science and discovery group who are advancing our knowledge in multiple disciplines, but also in the commercial application financed by the investor groups, such as Wall Street. The goals are to increase accuracy and precision, reduce human error, improve efficiency, and improve outcomes both in the near and long term, while at the same time providing a good return to investors who fund this pioneering effort. It is not known now how and to what extent robotic surgery will affect social relationships, specifically the doctor-patient and the other relationships, such as doctor and insurance third-party payers, doctor and hospital, doctor and malpractice medical, legal, doctor robotic industry, and others. This will be extremely complicated and will evolve over time. However, the provider, which is a surgeon, will still be responsible for the outcome of the surgery. Although increasingly impacted by robotic surgery, the robot only knows what humans have told it. Information in, information out. Bad information in, bad information out. However, if the surgeon does not like what the robot is about to do, the surgeon must stop the robot in time to rectify the proposed action. How this affects relationships with all parties will evolve as more procedures are performed and experience accumulated. Robotic surgery is already shaping the way people behave. Patients are calling providers' offices and immediately asking if the surgeon utilizes the latest technology, specific surgical approaches such as anterior versus posterior hip replacements, minimally invasive surgery, and robotic surgery. They will often not even schedule an appointment with a surgeon if those questions are not answered to their satisfaction. The patient often assumes that new is better, even though the newer technique may not have a long history of success or lack of long-term follow-up. Surgeons are forced to abandon time-tested successful techniques to adopt newer techniques that they are not familiar or comfortable with to satisfy patient demand. This increases the risk of complications and poor outcomes. The marketplace, pushed by the healthcare vendors, may be pushing newer techniques by stimulating the media to publicize newer technologies that reward the investor group. This is potentially a dangerous scenario. In the past few years, healthcare industry has integrated robots in the operating room and in its daily tasks. Some doctors use robots to check on and communicate with patients. This in turn has impacted employment in the medical field. In the past few decades, there has been an active debate about the future of the workplace with the inclusion of robots in our daily work. Robots working alongside humans or even replacing them is not an uncommon situation. Therefore, job security is an issue with the implementation of robots. Naturally, Naturally, as newer technologies impact any field, including healthcare, humans need to adjust. Employers will be restructuring staffing, some jobs will be eliminated, but others will be added. Specialists in various new tasks resulting from the deployment of robots will be needed. This will require new training programs to satisfy these changes, as our sophistication in performing these tasks in delivering quality health care is enhanced. The importance of developing a skilled workforce will be paramount. As we have already seen, the relevance of a traditional college education is being challenged by specific technology training programs. Higher education institutions will need to continue to adjust. This is the end of my video blog. I know that there is still so much more research to do, and by the end of this course, I have high hopes that I will deliver an excellent paper video blog with much more important information on the relationship between technology and societies regarding robotic surgery. Thank you.